Good evening, friends. You're most welcome to Think Eyes channel. Today we are going to discuss Practicing Anthropology by MAAN IGNOU, and our topic is Human Genetics and Society, in which we are going to discuss genetic counseling. Let us begin the topic. Genetic counseling is an important area of applied human genetics which can be practiced in the society. The counselor should have adequate knowledge in the counseling process. The counselor is preferably a medical doctor or a profession who is having knowledge in human genetics. The duty of a counselor is to offer the necessary genetic information and also the information about social, economic, and psychological aspect related through the case. Genetic counseling, defined by Harper 1984, is the process by which patients or relatives at risk of a disorder that may be hereditary are advised of the consequences of the disorder, the probability of developing and or transmitting it, and the ways in which this may be prevented or ameliorated. However, the American Society of Human Genetics 1975 formulated the definition as genetic counseling is a communication process which deals with the human problems associated with the risk of occurrence of a genetic disorder in a family. This consists of establishing an exact diagnosis and estimation of risk of recurrence or incidence in a family member. This process involves an attempt by one or more appropriately trained persons to help the individual or family to first, know the medical facts including the diagnosis, probable course of the disorder, and the available management. Second, understand the way hereditary contributes understand the way hereditary contributes to the disorder and the risk of recurrence in specified relatives. Appreciate the alternatives for dealing with the risk of recurrence. Select a course of action which seems to them appropriate in their view of their risk, their family goals, and their ethical and religious standards, and act in accordance with that decision. And last, fifth, to make the best possible adjustment to the disorder in an affected family member and or to the risk of recurrence of that disorder. Now let us see how genetic counseling is done. Firstly, it is necessary to identify people suffering from genetic disorder, and this is relatively easy for a trained clinician, but it is difficult to identify a carrier for genetic disease, and in most cases, it is not possible. However, information on the likelihood of an individual being a carrier for a genetic disease can be obtained by the analysis of family history or pedigree analysis as detailed below. Thereafter, the prospective parents, either suffering from or suspected to be heterozygous for some genetic disease, are advised about the risk of their would-be children suffering from the same disease. By creating a suitable social environment, such parents may be encouraged to voluntarily abstain from producing children. Pedigree analysis. Pedigree is a family history of hereditary conditions or diagram of a family history representing the family members, their relationships to proband the affected individual that brings family to medical attention, and their status with respect to a particular hereditary condition. While constructing a pedigree, following symbols can be used. The following diagrams present the standard symbols and relationship for pedigree analysis. Males are represented by squares and females by circles. Mating is represented by a horizontal line connecting a male and a female. Children are represented by vertical lines which go downwards from the parent's line. Advanced areas in practicing anthropology, in which we are going to discuss standardized pedigree symbols and relationships. A square symbol is represented by male, Circle represents female. Parallelogram represents sex unspecified. Rectangle represents proband. Black colored rectangle or circle represents affected. Half colored rectangle or half colored circle represents carrier, autosomal. And in circle, circle in circle, colored in circle represent carrier, X-linked. Rectangle, sorry, square cut or circle cut represent deceased. Square attached with circle, the link is cut by two lines which represent divorced. Circle and square both are connected with two lines represent consanguous mating. And there are so many other diagrams. First represents couple, horizontal line connects mates. Offsprings, vertical line connects parents with offspring. Second represents adopted. Third represents in adopted out. Second represent adopted in. Third represent adopted out. Fourth represent monozygotic twins. Fifth represent dizygotic twins. And last represent zygosity unknown. The inheritance pattern of biological characters, whether they are dominant or recessive for a particular genetic disease, is determined by pedigree analysis. The following diagram is an example of such pedigree. Circle square connects to circle square, colored square that connects to circle, and middle line is connected to four areas. There are two circle uncolored, one circle two square uncolored, one circle uncolored, and one square colored. Pedigree analysis assists the counselor to decide if a trait is Mendelian. It also assists the counselor to establish the mode of inheritance. In pedigree analysis, the first step is to observe the number and relationship of all individuals who express the same or similar clinical features. From this, we will be in a position to determine if the disorder is dominant or recessive, autosomal or X-linked by observing the typical patterns of inheritance. After having known the inheritance pattern of the disorder, we can evaluate the status of family members in the pedigree. Then by examining the position of affected individuals, mutation carried could be identified. Mutation carriers could be identified. With the data available, we can estimate the risk of carrier to other family members or the possibility that a couple may have an affected child.